Okay, very excited to be back with Grazel Garcia from Grazel Garcia Psychotherapy and Associates. Grazel, the last time we spoke, we spent a lot of time talking about EFT, and I thought it'd be really helpful for people to really get a handle on what an EFT session might look like. Um, so yeah, maybe just start us talking about how EFT differs from other types of therapy when you're actually in the room.
Yes. EFT is different in a way that it's very experiential. Like I think I've said that in my previous podcast with you a few weeks ago. And what you would expect as a couple if they come in is to expect that the work in understanding your conflicts and what moves you to conflicts is not going to start until probably the fourth session or the fifth session.
Hmm.
The first session is practically an intake session.
Hmm.
The second session and the third session is an individual session with each partner to gain more understanding about their attachment history that comes from their childhood.
Hmm.
And then the fourth session is when the couples come back, and then we actually then talk about what brings them into session, what's been the cause of their conflict that's been a repetitive issue. And then in the fifth session and on, that's when I go in or other EFT therapists where we look at understanding and tracking the negative cycle, which will have a ton of questions about, asking the couples, tell me a little bit about how you fight and what gets you to fighting
Hmm.
and whether they come back to each other to resolve the conflict or not.
Hmm.
In that's going to be stage one of the work, which is a very long process. So that's about 70% of the work because what we do there is we organize the elements of the emotions, which is a lot of work. And for me to organize that, it's going to depend on how the couple fights. Some couples are mildly escalated, some are moderately escalated, and some are very highly escalated. So it can take a while. So what they're going to see is me looking at what brings them into conflict, what happens in the moment, and what happens after.
Hmm. So
So,
I
yeah.
was just going to say, so is that sort of dealing with emotional triggers and how couples react to one another?
Yes.
Yeah.
Yes. I'm looking at the loop,
Yeah.
at the cycle, the inner cycle that they get into.
So that's the 70%, the bulk of the work. What happens after that point?
Once stage one ends, that means I've de-escalated the conflict, which means they're able to go home, be on their own, call out what their cycle looks like, be able to come back to each other and repair.
Hmm.
And the fight should be less and less and less.
Yeah.
Once they're not highly escalated or escalated and they're able to repair, then we go and move over to stage two, which is restructuring their bond that was broken in the past.
Hmm.
And that usually looks like going into their attachment history, what they bring in from their childhood into their interactions with their partners,
Hmm.
and how that causes conflict. And then I'm looking at that and restructuring it for them, creating a new attachment security for each one of them. And that's stage two. And
Yeah.
that's pretty much like 20% of the work.
Yeah.
Once the couple is de-escalated, it's a lot quicker to attain security and safety.
Mm.
But in stage one, both partners are highly escalated and they're in their protective strategies.
Hmm.
It makes sense that they're not going to feel safe to open up. So
Yeah.
that's why it's so important to escalate the conflict first.
Yeah, I hear you, and that makes total sense because you're not going to be able to feel safe in any kind of relationship if you know the second you open your mouth, your partner's just going to kind of come at you, or if that's what you're expecting. Um, yeah, it's never
Yes.
going to happen, is it? Um,
Yeah. So in stage one, we de-escalate the defenses,
hmm.
if that makes more sense for couples, right? In their perspective, what I'm doing is I'm softening your defenses so that you can feel safe to open up.
Yeah, and I know you said in stage two, that's when you look at attachment styles and kind of the childhood stuff. Do you find some of that
Mhm.
kind of historical work comes into stage one as well? Because obviously, if someone's got those kind of attachment wounds, that's going to affect how they react to their partner and kind of whether they're defensive or not. So, do you go into any of that in stage
Yes,
one?
I do,
Mhm.
because it does come up. Yeah, the attachment wounds is what forms our behaviors and our cognitive appraisals and how we move away or we move closer to our partners.
Mhm.
So we do look at it in stage one, but we don't go deep into it because we're still creating safety. We're still de-escalating the conflict.
Mhm.
And it's not safe to go deeper into the attachment wounds until there's safety created. So which is goes into stage two. That's where we deepen it.
Right. Okay.
Yeah. So it's a little tapping on, touching a little bit of it in stage one
Yeah.
and going really deep in stage two.
Yeah. And that's, I guess, that's where the really transformative work can happen in stage two. Um, Stage one, you're just sort of managing the symptoms, and then stage two, you're treating the disease, illness. Is that a fair analogy?
I would say just treating, the insecure attachment. Mostly, what's beautiful about EFT is that we're not looking at the disconnection in a way that it's a disease or an illness.
Yeah, yeah.
We're looking at it as a natural kind of process that evolves within and between partners when they feel unsafe. So restructuring the bond means um, we look deeper into what they're afraid of, what their attachment fears are, what their attachment needs are, and their longings that weren't met in childhood, that
Mhm.
they're looking to be met in their partnership. So that's where we come in as EFT therapists, is we make those attachment fears, needs, and longings more explicit
Mhm.
in hopes that they can, and then the partner can then receive it, hear it, and provide it. Right. It's a beautiful process. In that moment, it's so very telling because when the couples come in session, usually they come in and they're sitting on the couch separately on each end of the couch.
Mhm.
But as we move towards security and safety, they come closer and closer, almost kind of like they're sitting on top of each other. And that's when you know that the security and the bond with each other has been recreated and reestablished and reconstructed.
Yeah, that must be really encouraging to see when you can see those changes over time.
Yeah. It is.
Yeah. So we talked a little bit about kind of attachment issues, and it was really, I found it really interesting. You talked about attachment fears. Um, what would you say the most common attachment fears are for couples?
I'm afraid that my needs are not important. I'm afraid that I will be abandoned. I'm afraid that I will not be seen. I'm afraid that no one's going to attend to me. I'm afraid that I'm not enough, never going to be enough.
Yeah. You can straight away hear the impact of someone's childhood in those things when you distill it down to that. Um, you can kind
Yeah.
of you can feel the baggage in those words almost. It's heavy. It's really heavy.
And it's real, right?
Yeah, yeah, absolutely. And I can see that being quite difficult to get into in a session, especially. Yeah,
Mhm.
you're never going to get there if there's no safety in the relationship to start with anyway. So like that stage one work is so important again. Um,
Right.
so stage one is like 70% of the work. Then there's stage two, which is all about kind of repairing the bond, restructuring the bond. What happens after that?
After that, then we just move to stage three, which is consolidation of all of the work that they've done. Um, I talk about all the skills they've learned experientially, how they can maintain their secure attachment with each other, and practically reviewing, the changes that they've made over the course of time. And in that moment, the couples feel really, really good. They know that their relationship has changed. They know that they both feel safe with each other, and they know that therapy's over. They don't need me anymore.
Mm.
They can be on their own, which is beautiful. It's such a beautiful work.
That that sounds great, and it's really good that you've got that final stage in there, because I can imagine certain therapists, once they feel like a couple has got to a point where they're okay and can maybe go out on their own, they sort of say, okay, yeah, great, you're good now, on to the next one. But actually taking that time to really, as you say, consolidate and make sure that those changes are going to last. I guess that's what it comes down to, right?
Mm. Yes, absolutely.
Okay. Um, so in terms of what a session would actually look like, I'm just intrigued. Do you give your couples exercises to do? Is it mainly talking? You ask questions, they answer. Do you get them to look at each other or hold? Like, how does it actually work in practice?
Couples are very different, so they have different needs. So I attend to each one of them based on what's best for them, right? Within the EFT lens as well. And I accommodate their needs as much as I can. And most of the time with the EFT, we don't really give homeworks. It's not that type of therapy because it's very experiential, and giving homework makes it more non-experiential. So, however, if the couple is more they learn best in doing homework and experiencing their emotion, then yeah, I'm open to providing something that they can do at home where they're actually tracking their own cycle, where they're actually writing what they do
Mm-hmm.
in conflict, what they feel that they don't share,
Mm-hmm.
and what their attachment needs and longings are, so they can be ready for stage 2 work.
Yeah.
Um, some couples that are very highly escalated can be, I need to give them homework, like, assertiveness skills sheets, boundary setting, nonviolent communication. That way I can do more work in the room.
Yeah.
So, and some couples don't need that. So it just really depends.
Yeah. And I mean, I guess for some couples, sometimes you need the knowledge part to actually work on the heart part. So it's like if you don't have the awareness of what's going on for you at even a basic level, and you are just completely reacting because you're in fight flight like all the time because of whatever reason from your past, you're not going to be able
Mhm.
to engage in the work that you really need without that time to really get your head into gear and think, okay, so why am I reacting this way? Um, yeah,
Yeah.
that being really important.
It's very important because not every person is the same in the way that they learn
Mm,
things emotionally, especially based on, neurodiversity. Every single one of us are very different.
mm,
And I want to accommodate for each of the partner's needs. So if they need it, I'll give it to them.
yeah. And kind of touching on that, obviously there are specific segments of the population which may have particular needs. So I'm thinking maybe like interracial couples, LGBTQ couples, as you say, neurodiverse couples. How do you kind of accommodate for that in EFT? Do you have particular strategies to tailor things, or yeah, how does it work?
Yes, it's such a great question because EFT is the perfect modality for adapting EFT to work with different couples presentations. And so if it's an interracial couple, LGBTQI couple, and a neurodiverse couple, they all have different needs.
Yeah.
So the therapist must be able to be attuned to each of those couples' needs
Hmm.
because they differ. Their
Hmm.
needs differ, their attachment differ. their attachment needs and longings differ based on the systems of oppression
Mhm.
that has affected how they move in the world. So if you're not looking at it holistically in that way, there's a lot of things you're going to miss. So I cater, I'm doing a lot of training on this, and my next training is going to be on May 3rd. And this is such an important part of my training, is being able to see how you pace your work with neurodiverse couples, right? Um, Neurodiversity, it's a spectrum of different neurological ways of thinking
Mhm.
and functioning. So one person may be bored if someone's talking really slow, and there's nothing wrong with that.
Yeah.
So I need to probably pace the way I'm talking a lot quicker and a lot more shorter and um, very succinct,
Mhm.
right? And then some partners, some people need it to be slower,
Mhm.
right? They need it to be longer. So it depends. And then, some neurodiverse couples cannot have a longer session because it's too long and they get easily dysregulated or overwhelmed or overly stimulated. So a 50-minute session is all they need.
Yeah.
And then some couples in neurodiverse couples may need it a longer session. Same with interracial couples. The part that's different with interracial couples is that I'm looking at all different aspects of themselves based on who they are racially,
Mhm.
culturally, and how they've been affected by the systems that we live in that continues to oppress us. So I have to give a lot of room for that and really understand where they're coming from, whether that's oppression through health oppression, um, racism,
Mhm.
different socioeconomic statuses. So it's a different ballgame.
Yeah.
Yeah. And same for LGBTQI folks, you're looking at ways that same-sex couples are taking on roles that they shouldn't be taking on based on patriarchal systems of oppression. So you have to really look at them in different lenses.
Yeah, yeah. And if you're not able to adapt in that way, I guess this is where, because EFT is a little more free in terms of a couples therapy modality compared to, some of the other very, very structured, rigid processes, it probably does, as you say, lend itself better to accommodating all these different things, and you can really give a couple what they individually need rather than just saying, okay, well, in session one we do this, in session two we do that, and there's no flexibility in there. So yeah,
Mhm,
I mean,
mhm.
I think it's
Yes. I usually, yeah, I usually tell couples when they start with me is that they may experience my work very differently because I really attune to who they are first and look at the identities, the, intersections of their identities and how important those are. How important their identities in our work together.
yeah.
So some therapists are getting closer to applying that type of therapy in their work. And so I encourage a lot of people to look for that type of therapist that's more inclusive, is able to look at different nurse sections and how it affects their well-being and can cater to that.
Hmm. No, I mean it sounds great, and I can really see the value in what you do and what you offer for couples. Yeah, thank you so much for this conversation, and I'll speak to you again soon.
Okay. Thanks, Scott. It's so nice to see you.